Have you been told that your pelvic floor is weak, but every time you try to fix it with Kegels, things get worse? Let's clear this up right now. Your pelvic floor is not weak. It's actually too tight. And friends, that changes everything. Today, we're going to be talking about the common misconception of my pelvic floor is weak. What's really going on with your pelvic floor and what you should be doing instead of Kegel exercises. Now, friends, I understand many of you who are watching this may have been told by a pelvic floor physical therapist that your pelvic floor is indeed weak. Before you drop a comment, please watch to the end of this video because I'm going to explain why your pelvic floor is probably not weak. It's probably too tight. I'm Dr. Amy, PhD trained in orthopedic manual physical therapy, and I believe that movement is life. I have treated hundreds of women with pelvic floor dysfunction and been told by them that their pelvic floor is weak. However, when I do the evaluation, I find 100% of the time that the pelvic floor is actually tight and not weak. Ready to learn more? So many women are told that their pelvic floor is weak if they have any issues with leakage, any kind of incontinence, any pressure or bulging sensation, or if they have pain, either pain with walking or inserting a tampon or during intimacy. They're encouraged to do Kegel exercises to strengthen those muscles, but tightening an already tight muscle only makes things worse. Let's talk about the truth behind a tight pelvic floor. A tight pelvic floor isn't a strong one. It's an overactive and fatigued pelvic floor. The muscles are already clenched, leaving no room for them to contract when needed. I mean, imagine holding your fist clenched all day. Would that make it stronger or just make it tired? And this constant tension also decreases blood flow, which means you have more difficulty healing from any issues in your pelvic floor. So what are common symptoms of a tight pelvic floor? The one that people usually start with is urinary leakage when they're coughing, sneezing, or laughing. If left untreated, this can progress and get worse over time. For some people, then it will turn into pelvic pressure and potentially even a pelvic prolapse, which is a sense of fullness or pain in the pelvic floor. Some people's tension symptoms start with pain during intimacy or even when inserting a tampon. And here's one most people don't know. If you're suffering with constipation or difficulty fully emptying your bladder, that can be a sign of a tight pelvic floor. And your hip pain, low back pain, or even tailbone pain could also be a sign of a tight pelvic floor. If this is all starting to make sense and you're realizing that Kegels are not the answer to your problems, please click that like button and don't forget to subscribe to learn more about how your body works and how to get it to relax. So why is it that Kegels actually make things worse and not better? Well, Kegels focus on squeezing and not relaxing. If you can't relax first, you're reinforcing tension as opposed to allowing for a normal contraction. A constantly tight muscle can't activate properly. Again, go back to that fist. If you're clenched all day long and then you try to grab something, you have to be able to relax in order to be able to hold it. And let's go back to that fist example. If you're chronically tight and holding that fist, how are you able to open your palm to be able to catch something like a ball or something falling off the counter? You have to be able to relax for that palm to open so that you can catch what you want. You see, true strength requires balance, both the contraction and the relaxation. Okay, that's a lot of negativity. Let's focus on the positive. Let's give you some things you can do to start helping your pelvic floor today. First thing, we need to start with relaxation or relaxing that pelvic floor. The best way to start doing this is by focusing on your deep breathing. You see, the diaphragm, which is the muscle at the base of your ribs that is responsible for that deep belly breathing, works in opposition to the pelvic floor. Think about it when you poop, you're going to contract your diaphragm and relax your pelvic floor. However, if one of them is tight, the other one decides to be tight, thereby increasing the pressure in the abdominal cavity. So, doing some deep breathing and getting that diaphragm to contract and relax properly will have an effect on the pelvic floor as it learns how to contract and relax properly too. I often recommend to women that they do some self-massage of their pelvic floor. This not only helps to decrease muscle tension, but also helps to connect your brain to your pelvic floor so that you can learn how to relax it. It's also really important to focus on your posture and your alignment. As women, we tend to sit cross-legged or stand with all of our weight on one hip or carry a child on one hip all the time. It's important to remember that we want to keep equal weight through both feet when we're standing and equal weight through both cheeks when we're sitting. It's also important to focus on full body movement. It's not just about your pelvic floor. So activities like walking or yoga, where you're getting gentle, pain-free motion through your body, will help to decrease the tension in your pelvic floor. I hope that we have helped to reframe your thoughts on strength, because strength isn't just about tightening. A truly healed pelvic floor can contract and relax and move with you through all the activities you want to do in your life. And once your muscles can fully relax, and only once your muscles can fully relax, can you start a strengthening program to help restore that normal tone in your pelvic floor. If this message resonated with you, your pelvic floor isn't weak. It's just crying out for balance. Don't forget to hit that like button and subscribe for more pelvic health content. And if you want to learn the one exercise I recommend instead of Kegel exercises, you're going to want to check out this video right over here.